Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Real common problem here, Brad. I see in a lot of patients, peripheral neuropathy relief in feet and legs. These are physical therapy treatments.
Right. This is oftentimes related to people who have diabetes. It's very common with that, so which is becoming more and more, unfortunately, more prevalent.
It is, and I saw two patients yesterday with peripheral neuropathy, and it's really difficult to live with because it does get very painful. And
interferes with your balance, your walking, a lot of other things.
Yeah, it can cause falls.
Sure.
Because you can get foot drop and such. So, but before we do that, if you are new to our channel, please take a second to subscribe to us. We beg of you. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go over to the Facebook and Facebook. I don't know.
The Facebook, face the book.
Bob and Brad.
Anyways, like us.
And like us, yeah. We'll give you some positive vibes out there. You'll feel them. All right. The thing with what's going on with peripheral neuropathy, peripheral means the nerves in the extremities, basically, not the spinal cord we're not talking about.
Right.
Or the brain. These are the nerves that provide motor function and sensation to the extremities. And in some fashion, they're damaged. I mean, that's what peripheral neuropathy is. There's an abnormal condition of the nerves.
Oftentimes a gradual, it starts with very little bit, maybe in the feet or the toes, and kind of works its way proximal.
Yeah.
Right.
And it tends to be more common in the feet and legs than it is in the hands. I mean, but you can get them in both.
Sure.
And there are medications and stuff, which, you know, our goal today is going to be, you want to increase the circulation to help promote healing and regeneration. Now, I read at one point, Brad, there was like 100 different types of peripheral neuropathy. That's how many different variations there are of it. But, and you know, the amount of regeneration you get may be minimal, but what you definitely want to try to do is stop the progression of it.
Right. If you can't reverse it, stop it from getting worse, or getting worse at a slower rate.
Right.
You know, unfortunately, that may be the best you can do.
The best you can do, right.
Right.
So you'll want to first get a medical workup because there's a lot of things that can be causing peripheral neuropathy that are maybe a lot more easily treatable, such as a vitamin deficiency.
Sure.
One that you can't treat easily, but it would be alcoholism. I mean, you got to stop your drinking, obviously, in that case. There's medications that can lead to this, and of course, diabetes that we already mentioned.
Right.
So.
But along with that, circulation is a basic need for no matter what type of neuropathy you have. Circulation is very important and is going to help.
So let's start off with the first one, Brad. I like to always do a stretch to the calf. Do you want to give me a strap or something?
Sure.
There's a strap right up in there.
We'll just use this one, Bob.
Yeah.
Funny we have one here. I can't get to it.
Now you can use a belt, or you could take a rolled up sheet. Here's the stretch out strap, or we haven't used this one in a while, have we, Brad?
No, but it still works, Bob. They last a long time.
Now you can put...
Here's a towel roll. You could do that if you wanted.
You don't need to buy anything, but this does have a nice loop, and you can go ahead and put it in there.
It works better.
And then you can put your hands in the loops, and it's just really easy to do.
If you have problems with grip, the loops are really handy. They take that problem right away. And he's getting a nice stretch to his ankle and in that calf muscle.
Yeah, and one of the reasons we want to stretch it is because if this muscle starts to become weak, the one that helps hold your foot up, all of a sudden you're going to find out you're going to lack the ability to bring the foot up, and then you're going to start dragging your foot when you walk.
Right, you get that toe drop or foot drag.
Foot drop, and then you're going to start being more likely to catch your toe, and then you're going to be more likely to fall. So, I mean, you want to keep this stretched out, and you want to do it on both sides.
Right.
A good 30 seconds to a minute stretch is all you need to do.
It usually works better with the shoe on because it kind of grips to the strap. You can do it with the shoe off, but the shoe on is a little easier.
Now these next ones you can do just on the bed like this, but it might be helpful to have a foam roller, or we have a rolled up sheet. Remember that, Brad, too?
Oh, yes. We'll just use this one.
Yeah, just take a rolled up sheet. We got some tape around it to make it easy, but this is nice because it brings your foot up, you know.
Right, elevates it.
So you're going to want to start doing, you know, the ankle pumps. And these are ones that I would not only recommend doing it during your exercise period, but throughout the day, you should be trying to perform these ankle pumps while you're seated, while you're
Right, you don't have to have it elevated. If you're sitting at an office desk, do them while you're seated. It's still going to get some more fluid moving.
Yeah, and then you're going to do circles too.
Ah, yes.
You're going to go clockwise and counterclockwise. And if you don't know which one is which, it doesn't matter.
Yeah,
just
do
both.
both. And
Yeah,
you're clear.
you're eventually going to get to the right one.
Just don't tell anybody you don't know which way is which.
We try to keep it a secret. Okay. Next one, Brad, is a nice one to do. Is actually just straight leg raises. So I'm going to lay down. And
now you might think, why was he just doing straight leg raises? Because it's got nothing to do with the ankle.
Exactly.
But it does.
It does, because you want to promote circulation through the whole leg.
Right.
The arteries, coming from up in the body here, the main femoral nerve artery vein.
Right.
So you want to make sure that you're working everything. I put the one leg up like this, and you just start doing some straight leg raises like this.
And the fluid all has to move this way anyways. If you're plugged up here, it's not going to circulate through, so to speak. It doesn't really get plugged up, but we want that motion, that fluid moving throughout the whole leg. Plus, you got gravity. When you're up here, you got gravity working down, which is a big help. Take advantage of it.
Those are not that easy to do either, by the way. I was starting to feel it in the 15. Of course, I got a long limb here.
Yeah, he's 6.5 foot tall. He's got a 6 foot leg. He's all
yeah. All right. Then we're going to do hip abduction, Brad. I don't know if this is my best side, but I'm going to go ahead and go out and start doing some abduction here. I'm keeping the toes straight forward.
I'll stand here so they only can see your leg.
I'm not going like this.
Yeah.
I'm not going down like this. I'm going toes straight forward.
Right. So he's talking about, if you didn't see that, because the tendency is for this to happen.
Right.
So keep it this way, and that's going to work the stabilizing muscle. Make your walking more stable, too.
So I'd say just, again, you don't have to take a long time. A lot of these you can do in bed before you even get out of bed.
Sure.
And a good set of 15 you can work on and doing that. So then we're going to go ahead, Brad, and we're going to go ahead and, you want to show the standing ones? Just get behind a chair. These are good. I like these to do throughout the day even.
Can you pan this way? Yeah, get Bob out of the picture. He's had enough camera time.
That's right.
All right. So
do heel to toe raises.
Sure. And this is one, just to have some balance here. I had someone in the last year, he had peripheral neuropathy, and he couldn't feel the ground very well at all. And he had a hard time doing these, but we did have him do that to get more circulation. His fall rate was pretty high, actually, because he couldn't feel the floor with his feet. So that's unfortunate. But he was a walker, and that was helpful.
Can I emphasize, I would do these throughout the day, not just pick one moment. And then you can go to the single, he's going to go ahead and do single leg raises too, Brad.
Oh, yeah.
Heel to toe.
Well, I wanted to do some hip abduction
Yeah,
first.
that's a good idea.
And then you make sure you get both sides. Notice the toe is not pointed out, but like this.
Brad is a maverick. He basically does
once I get my mindset, Bob, you're not changing it. My wife knows that. You know it well enough, too.
Yeah, I do.
Soon Liz will also.
That's right.
When this is too easy, and some people, especially older people,
they may never get to this.
They may not get to the single leg.
That's hard work.
Right. But if you can, that's a good way to progress to it. So, and it's important that you go back up and pull the toes up as well as get the heel up. They're both important muscle groups for walking, for balance, circulation.
And then speaking of balance, Brad, can you just show how you can go ahead and balance on one foot? And
Sure.
You can maybe start with both hands.
Yeah, so both hands on the cupboard on a good solid chair, not a flimsy chair. And you can just stand. Just last week this was a woman of mine, this was one of her exercises at home. Stand on one foot and see if she could do it. If you're 60, 70 years old, if you can go for 5 seconds, your probably balance is fairly decent.
Yeah, and you may want to start by hanging out with just one arm. As the progression, 2 arms to 1 arm to no arms.
Yep, and then you can actually go to fingertip.
Yep.
3 fingertips, 1 fingertip.
Sure.
And I'm not kidding either.
It makes a big difference.
Yeah, it does. One little touch like that can make a big difference. And then like this. So they're all good exercises to do, whatever you need is for.
All right, we're going to mention one product, and I feel a little bit bad about this because I have not used it on somebody with peripheral neuropathy, but it makes big sense to me. We've mentioned this in a different video. It's a massager for the feet, and I'll tell you, the response has been on our end as far as using it on people inside like our clinic and stuff. I mean, I haven't found yet a person that hasn't loved it.
Right.
I mean, it's just, I've had many people say that they were having foot pain for quite a while. They started using this and their foot pain went away. Now, again, it's not going to make peripheral neuropathy go away.
Right, but some of the symptoms, will be feeling better. This actually puts some pressure on the leg to help push out some of the fluid if you have some edema. But then it massages particularly the bottom of the foot with some rollers.
Yeah, and I want to definitely try this with somebody with peripheral neuropathy. So if you guys are out there and you want to come over to our clinic and
Yeah.
but anyway, it's the HOPFU HOPV or HOPFU Shiatsu foot massager. You got to say Shiatsu.
Shiatsu, there.
And it's got 2 holes in there. You can go ahead. I'm just going to stick one in there right now. And it does have a heating setting, but the heat is very minimal. I hardly even feel it, to be honest.
It's not gonna. It's like in the wintertime, you're not gonna warm your feet up.
Right.
But you're gonna get the massage and the compression.
It's got 3 different modes, but to me that's not that important. To me, the most important mode is the strength mode. There's a low, medium, and high. And I would definitely, if you get this, start with the low to see if you can tolerate it. And then move on to the medium, and if you're a younger person, you maybe go to the high, or if you have pretty decent feet, you can go to the high.
Sure.
Because I can go to the high, Brad.
Yeah, the high is a little on the aggressive side.
Yeah,
so
it is.
It's going to start out low, and you don't have to do 1 foot at a time like Bob is. You can put both feet.
No,
in.
you definitely want to put both feet in. And
Well, I didn't know if you were.
I guess there's no reason why
You
I'm
got
not.
slip-ons. Put them
I
in
know.
and take advantage.
Okay.
My gosh, what are people going to think?
Yeah, now I can't get my foot in there because it's being massaged right now.
Oh, well.
I have to wait.
You have to wait till the.
I can. Hold on.
Hold on.
Hold on.
People aren't going to hold on. They've
They
got
will.
things to do, Bob.
No, they will.
Okay.
Okay. All right. As you're going off into the sunset, we'll just remember we can fix just about anything
Except for.
a broken heart.
There you go.
But we're working on it.
Enjoy.
Thanks.